Welcome to Connect to Develop, where we provide insight from healthcare leaders on the hottest topic and trends.
Hello, listeners. Today we have an incredible guest for our series of Why I Went into Healthcare. Dr. Peter Gold is a board-certified, fellowship-trained hip and knee surgeon at Panorama Orthopaedics in Golden, Colorado. Peter's a third-generation physician, so he kind of knew what he was getting into, although maybe not exactly from the surgeon side, and completed his residency at NorthShore-LIJ in New York as an adult hip and knee construction fellowship from the Rothman Orthopedic Institute in Philadelphia. Dr. Gold is very active in his subspecialty, serving on various committees for the American Association of Hip and Knee Surgeons, also known as AAHKS, and also the Young Arthroplasty Group, which sits under AAHKS and really helps the future generations of leaders prepare for their next role in leadership. Thanks for joining us today, Peter.
Thank you so much for having me. Glad to be here.
Okay, delving right in, tell us about why you got into medicine. Was there anything specifically amongst your father, your grandfather that inspired you to get into medicine?
Yes, that's a great question. For me, when I was growing up, my dad would go to work every day, come home every day, happy. And, seeing him, he's a pediatric ophthalmologist, and seeing him having a career which gave him so much fulfillment and so much joy, taking care of people, I really connected with that. And, that's what kind of inspired me to become a doctor, knowing that, I know that by taking care of people, I know I'm going to get up every morning and come home from work every day and be happy. One cool thing from my grandfather that really inspired me, just kind of to show what things you could do with medicine. He helped make the rubella vaccine. He helped make a lot of antibiotics like Ancef, which we use. My grandma's name is Ann Gold. And so he actually named Ancef after my grandma Ann. Every time I go to work, I get to be happy and I get to hear my grandma.
I have to assume that watching your father and your grandfather, who are not surgical, come home and have these incredible stories about how they helped patients.
Yeah, I think for me, I'm very much a hands-on kind of person. And I think I perform really well under pressure and can really help, manage a team and manage a group of people, while the stakes are pretty high. And, I really kind of gravitated towards orthopedics in that way because it's just kind of how my brain works, right? You have these muscles in this compartment, these arteries and these nerves go to this compartment, to these muscles. And so, yeah, it just kind of fit for me of, being able to take care of people in somewhat high stakes situations, but doing it in a way that's very, structured and kind of makes sense from A to B to C. And I think also for me, I've been a patient myself, even in, traumatic situations. When I was in medical school, I saw a man kidnapping a woman and I tried to stop him from kidnapping her. He didn't like that. And he ended up shooting me in the stomach. And, I was that trauma patient. And so I think, when you go through something like that and, you're the doctor is now the patient, you get a really good perspective on a lot of things that go on in the hospital. And I really think it kind of helped shape the way that, I want to take care of people, and really trying to, give patients confidence. I think my doctors, when they came in the room and they answered all the questions, they were very clear, very concise, and they did it very confidently. And it was what I call kind of confidence based in knowledge. And, that confidence based in knowledge really helped me as a patient, stay calm, stay stable, and kind of know that there was a path forward. And so, having been through those situations myself, I really think it's kind of helped me, figure out how to help others.
I don't want to completely jump off track, but I do want to unpack a little bit. So you watched a man trying to take a woman against her will. You jumped in. There is a little bit more to that story. Can you please unpack not only more to that story, but what you did afterwards to help people like him? Because when I heard this, I got to admit, viewers, not to get too emotional, I teared up. So get ready for some water work. So Peter, please share that with us.
Yeah, I'm one of those people that I believe that there's inherent good within everybody. So, I'd like to believe that, if any of us were kind of in a situation where you see something, like this, a kidnapping kind of happen, and you're the only person there, and you kind of in a gut decision, you're either going to keep going and live the rest of your life knowing that you saw something like this happening and you didn't do anything, or, you can live the rest of your life knowing that you did your best, when it was kind of your time. And so, luckily my instincts just kind of really took the best of me. I didn't even think, does he have a gun, a knife? It didn't even cross my mind until, I was too deep into the situation. But yeah, I think being at the wrong place at the right time and, trying to do the right thing, even when nobody's looking, I've gotten some good credit from the universe that if you do that, then more likely than not, good things should come of it. Yeah, to your second question of, what did I do with that? The whole thing was on surveillance camera. It was on CNN and all the news stations. And a couple of the different, CBS, Today Show, they wanted to do some interviews with me, as it was a national news story. And I got together with a group of my friends and, we were like, hey, this is something that the public is interested in. What can we do with this attention, to try to, really highlight the actual story, which wasn't me being there. It was, how did somebody, like this man get to being 20, 21 years old and at a point where, if he wants something, he wants to take it. And if anything gets in his way, he's going to take them out. And, that's the real story. Like, how does somebody get to that point in their life where that's rational and that's justified? And so, we decided to launch our own 501c3 called Strong City, which is still going strong in New Orleans. And what we do is we partner with community organizations in New Orleans that work with underserved youth. And we provide them grants and money and cargo vans and drumline uniforms and, kind of anything that they need so that we can kind of help those people serve these kids who really need the support and love.
I am speechless, Dr. Gold, as you're going through that story. One, thank you so much for sharing with us. I can only imagine, thinking back to that, how much of that just adds so much perspective as you shared already. So when you're caring for patients today and you're kind of thinking through some of the dynamics that you've been through, what I'm imagining is you're drawing so much empathy and relatability with your patients. How has that impacted, I guess, the relationships with your patients? Do you see that kind of evolve and look different? I'm hearing such an empathetic approach simply for the experiences that you've been through and what you've shared with us.
Yeah, for sure. First off, luckily I'm taking care of orthopedic patients and not general surgery trauma patients. People always ask me, how did I not go into gen surge trauma? But I still, even after that, have no interest in that at all. So yeah, I think for me, the way it shows up is I'm just like everybody else, right? I get caught up in the hustle and bustle and the speed, and we're trying to take care of as many people as we can and having 2 rooms and trying to, do as many operations as we can a day. Like, I get caught up in that same speed all the time. And, I think to your point, there will be a look in a patient's eye or just the way that they ask a question or the way that they hesitate in saying something that will just unconsciously catch me. And it will very much remind me of how scared I was as a patient and how frightening it was, not only for me as a patient, but how scary the whole situation is, for my family and for my friends and people that, are going along this, healthcare journey, with you. So whether it's, me as a trauma patient or somebody getting a knee replacement, every patient has some level of fear and is worried. And so, yeah, like I said, there will be something, the way the patient does something that will subconsciously catch my attention and just really remind myself, hey, Peter, you need to slow down. Like this, what this fear that this person has, slow down, kind of get down to their level, meet them where they're at. And then just like my doctors did for me, try to provide my patients with confidence based in the knowledge that I can give them.
Thank you for that, Dr. Gold. That's, again, as I'm listening, I'm literally speechless, which doesn't happen often.
Was there a mentor that you watched their process either, as a sub-I, as a resident, as a fellow, maybe even, in training, that as you developed your practice, you went, I'm going to combine all of this and here's how we do it. Here's how we make it make sense. Who was that for you, if anyone?
That's a really, really good question. Yeah, I think for me, it's a combination of, people from residency and fellowship, from residency and people like Dr. Baraya, Dr. Danoff, and Dr. Risquina. And I'll come back to kind of a special story about Dr. Risquina. And then in fellowship, people like Max Portney and Chad Kruger and Matt Austin, were all super influential. And, especially the way that Rothman, has kind of put together this really impressive, efficient practice. Even with that, you have just really great doctors. And like I said, all of those guys, I mean, they not only are, being super efficient in the operating room in the office, but they're really taking really good care of their patients. And so, I've always kind of modeled that. I think the other thing I modeled, from the Rothman guys as well is, I never saw any of them get frustrated, get upset in the operating room, no matter what happened, whether there was a complication, there was an issue, whether the fellow did something, all the time they stayed totally calm. They treated the staff like their family, and they did whatever they needed to do to make sure that patient got the best outcome that they could and do it in a really classy way. So that's something I really, kind of looked up to for them, and I'm still learning how to emulate that early in practice for sure. Yeah, and one other kind of important story about, Dr. Rusquina, who was one of my mentors in residency. He's the reason why I went into total joint replacements. He was the first person I saw that had 2 rooms and was efficient and, just really had a great relationship with the patients and with the staff. And, unfortunately, just after COVID in 2020, he took his own life and died by suicide. And for me, that was really a wake-up call. Not only, we're talking about empathy for our patients, but, it's a really strong passion of mine and the dedication that I have, not only to our patients, but also to our colleagues, and empathy towards, what we're doing and how much stress and energy that it takes up. And as arthroplasty surgeons, we're all workaholics, and we will not stop, and we will keep going. And so, for me, I think it's really important to have more of these conversations and, talk more deeply about how, we can all be, better humans first, and then, therefore we can be better doctors, and then, kind of influence healthcare in a positive way. So yeah, I've been super fortunate to have a lot of different mentors that have taught me things positively. And, unfortunately, with Dr. Ruskina from a negative standpoint, but, really taught me a lot and is really kind of driving a lot of things that I'm motivated to kind of work on, with our colleagues in the future.
Yeah, thanks again for sharing that. I can only imagine, what that going through that must have been like. And just kind of adding another question to your explanation, I guess with that being said, what are the key things that you really want to mirror for your colleagues, right? Like you're talking and you're sharing those key things that your mentors displayed. And so what are the, top 3 things that as you have new residents and fellows coming in and early career surgeons coming around you, what are those first, I guess, teaching moments and time that you're spending with them? You're in, the break room, or you're having one-on-one, just with all of the lessons and experiences. What would you share?
Yeah, I think I know that as a arthroplasty society and, just in conversations, I mean, we're really moving in this direction. And, the kind of main points or kind of key things for me is, you think about us as arthroplasty surgeons, we are perfectionists just by the nature of what we do, right? No one becomes a joint replacement surgeon and wants to do the same 2 operations over and over again, unless like you have a drive to be a perfectionist, which is great. But the other side of being a perfectionist is, you have difficulty, humanizing yourself, and any tiny mistake, becomes this huge dagger to your perfectionism. And so I think that in combination with, maybe the past culture within arthroplasty has been one of, oh, you had this problem, like just put it behind you and keep moving. You have something else to do. And, there really hasn't been the infrastructure or just like the safe spaces for surgeons to just talk to other surgeons about, what's going on and what they're dealing with. I mean, every single surgeon has to deal with complications, and all of us suffer from it. We're a second victim of the complications that happen to our patients. And, I think just when you're talking to residents, talking to fellows, or, kind of have an opportunity, whether it's at conferences or, just on the off times with your colleagues, just being able to just like take a step back and have real conversations and just being vulnerable about, hey, this complication happened, it's been weighing on me. And, when you can have a conversation with a colleague who no doubtedly is going through the same thing, that's really just kind of the start. And so, yeah, I think just, you being vulnerable yourself and being willing to have these conversations with colleagues. And then, just kind of continuing to do that over time and, building out an infrastructure and building out a network of trusted friends that you can go to when you have a problem, because sometimes the burnout's going to add up, the stress is going to add up. And, if you don't have that list of colleagues and family and friends to call and just say, hey, I'm having a bad week, it's not going to end well for you if you don't kind of build that network.
Was it this network that you found that you supported, that supported you, prompted you to get involved on a national level? Because let's be honest, you went into private practice in a very niche location. You had this incredible empathy towards your patients. You entered into a phenomenal, from a reputation standpoint, a size standpoint. I mean, you had all of the things. What made you then want to then donate even more time as, AUKUS health policy and, YAG and all of these different things? I mean, what's the impetus behind that?
For me, being involved with an organization like AUKUS and, being a part of the Young Arthroplasty group, it helps me connect to my purpose and my why for doing what we're doing. I think if I was just, drive to work, see patients in the office, drive to the hospital, operate, go home, and it was just that over and over and over and over and over again, and there wasn't this connection with our other colleagues, and there wasn't this call to action of like, how can we continue to do what we're doing better for our patients? How can we continue to do what we're doing better for each other as colleagues? If it wasn't, for that extra connection and a call to something that's a little bit bigger than ourselves, then I think for me personally, I would feel like I'm on that kind of cog on the wheel and in that rat race. So for me, spending that extra time connecting with colleagues and friends and, again, trying to make what we do better, I find a lot of purpose and a lot of meaning in that. It helps to drive, my day-to-day much, much better.
I love just the reference of community and the importance of colleagues, but you're also anchored in your why. So do you hold on? Is that what drives you day to day? When you have those moments and cases are running long and the meetings never end and you're just utterly exhausted, to your point, you're all human as well, right? You're feeling the same things that patients feel and your colleagues, and you're all sharing in that. So in the moment, what is it that keeps you going?
I think for me, when I try to get to the simplest form of like what my why is, it's really about like taking loving care of the people around me. And so I think that kind of opens it up to many opportunities to feel connected to your purpose, right? So like your example, like when it's late night and cases are going long, how do I stay connected to it? It's like, hey, there's a patient on the table in front of us that I'm going to do the best that I can for. Then there's the team in the operating room, the scrub tech, the company rep, circulating nurse, my PA, the anesthesiologist, and we spent a lot of time together creating this kind of team atmosphere and a family atmosphere. So, I'm not only doing it for the patient, but I'm also doing it together, with this group and with this team that, I also care for and try to care for them as much as the patient. And then that can kind of spiral out. So yeah, I think just trying to stay connected for me to, am I taking loving care of whatever situation that I'm in? And, the times that I'm not doing that, I'm certainly unhappy, and just like all of us, there's so many times where you get disconnected to your why and to your purpose. And sometimes it's challenging to stay there, but the times when you do and you're in alignment, we really, just like my dad coming home and going to work every day feeling fulfilled, you really do get that fulfillment of a great job and having it be an honor to be taking care of the people around you.
Well, Peter, that's our time for now. This has been humbling, absolutely extraordinary. We are so grateful for you coming on and sharing your story. And we'd love to hear from others on what their why is and what their North Star and their defining purpose is. And for those of you who would love to learn more about or connect with Dr. Gold, please see his bio in the show notes. And thank you again, Peter, for joining us.
Thank you guys so much. It was a really great conversation. And having this conversation helps reconnect me to my why as well. So thank you guys for that.
You can find more interviews on our YouTube channel at Marney Reid Presents.